Have you ever stopped to think that sometimes the choices that seem the safest are precisely the ones that lead us to regret? And what if I told you there are things nobody tells you before entering a nursing home? Uncomfortable truths, hard to hear, but they need to be said. Because once you cross that door, many things change, and not always for the better. For years, I practiced as a geriatric physician. I accompanied hundreds of patients entering institutions with the promise of care and comfort. But what I saw behind those spotless hallways and organized routines were stories of silent suffering, loss of autonomy, loneliness, lack of purpose, and a kind of aging that gradually extinguishes the essence of who those people are. That's why this video exists. Because there are 6 things I wish I had told every patient and every family before making that decision. Things you won't find in brochures or guided tours. These are profound lessons learned from those who experienced firsthand the impact of being separated from their own home, their freedom, their story. But before we go on, I ask you one simple thing. Subscribe to the channel. It's not just to help me. It's to make sure you receive content that can transform how you approach health in later life, your daily habits, and the path to longevity filled with dignity and awareness. Because believe me, what you're about to hear here, no one else is telling you. In this video, you'll discover what happens when an elderly person loses control over small daily choices. You'll understand why the silence of a shared room can do more harm than a serious diagnosis. You'll meet Francisco's story, Maria's story, and many others who taught me that living well isn't just being alive. It's keeping the flame of purpose, respect, and freedom burning until the very last breath. Stay with me until the end, because each of these 6 points is both a warning sign and a prevention roadmap. And if you pay attention, you'll see there's still time. Time to care, time to change, time to make sure you or someone you love doesn't enter this path blindly. Because what I'm about to tell you now might be exactly what prevents a future of regret. Few people imagine the real impact of losing the right to decide their own routine. And that's exactly what happened to Mr. Francisco, 81. When he moved into a nursing home in San Bernardo. There, he could no longer choose when to wake up, what clothes to wear, or even what to have for breakfast. Everything seemed planned with good intentions, but it felt like someone had erased his life story. What looked like mere institutional organization became a silent trigger for the loss of his identity. And when an elderly person loses their identity, they also lose the drive and the will to fight for their own health. Studies in geriatrics have shown that maintaining small daily decisions, like choosing shower time or the position of a chair, preserves self-esteem and strengthens the immune system. Autonomy, in this case, isn't a luxury. It's disease prevention. Harvard University published research revealing that seniors with the freedom to make simple choices showed a lower incidence of cardiovascular disease and depressive episodes. And if the body responds better to autonomy, so does the mind. One patient once told me, "Doctor, just choosing my teacup makes me feel alive again." That phrase never left my mind. It's essential to understand that health in later life goes far beyond having up-to-date tests. It also involves allowing the elder to maintain their daily habits, even if adapted to a new reality. Francisco, for example, was passionate about his plaid wool vests. Only when we allowed him to wear them again, even on the hottest days, did we see a different sparkle in his eyes. That wasn't vanity, it was resilience. It was a man recovering with a simple gesture his vital strength. Longevity isn't built solely on medication, but on respect. If I could tell families one thing before placing a loved one in a nursing home, it would be, don't strip away all their choices. Even in a controlled environment, you can preserve autonomy with wisdom and affection. Losing control over one's body and routine can trigger an accelerated aging process. And no one wants that for someone they love. And you know what's most curious? After Francisco regained his small decisions, he asked to plant a basil plant on the balcony. He said it would remind him every day that he could still make a difference, and he did. Have you ever wondered what happens when an elderly heart falls silent for lack of company? It's as if time begins to move slower and heavier. Many seniors in nursing homes go entire days without hearing a single affectionate conversation. The absence of visits, hugs, and genuine exchanges becomes a pain unseen in tests, but that eats away at the soul. That emotional pain has a name and real effects: chronic loneliness, which worsens conditions like hypertension, diabetes, and even cancer. A silence that makes you sick inside and out. In my years of practice, I saw patients lose weight for no apparent reason, simply because they lost their zest for life. Science explains it. Loneliness elevates cortisol, the stress hormone, which in excess increases risk factors for heart disease and inflammation. And the scariest part, this can happen even with a balanced diet and the right medications. An empty heart calls for help in the form of a sick body. When we talk about health in later life, we must understand that touch, eye contact, and attentive listening heal more than many prescription drugs. I had a patient named Elsa who would say every week, "Doctor, I don't need a prescription. Just listen to me for 15 minutes." And in that time, she'd cry, laugh, recall her late husband and distant children. That small ritual became an emotional vitamin. Elsa began sleeping better, regained her appetite, and surprisingly even reduced her blood pressure medication. It wasn't a miracle. It was disease prevention through active listening and loving presence. Sometimes the secret is offering companionship with your whole heart. So now I ask you, is this content resonating with you? If these insights touch your heart, subscribe to the channel now. You'll receive more transformative content on healthy aging, well-being, and how to live with dignity and strength, even in the face of life's challenges. And remember, sometimes your comment here is like a visit for someone reading, and every good visit, believe me, renews the soul. Let's go together, because what comes next will surprise you. There's something profoundly devastating when an elderly person starts to believe their usefulness in the world is over. And it doesn't happen overnight. It settles in gradually, like a thin fog erasing the sparkle of small joys. In many nursing homes where routines are rigid and every day feels the same, residents see themselves as just another occupied room. But lacking purpose is not just sadness, it's a silent poison to body and mind. Without a reason to get out of bed, the brain slows its activity and the body follows suit, losing vigor, resilience, and even hope. The University of Michigan conducted a fascinating study on perceived usefulness in older adults. Those who felt they could still contribute, even through simple tasks, had a 25% lower risk of developing dementia. The secret was in the small things: tending a plant, writing letters, sewing dishcloths, doing puzzles with grandchildren. A simple role becomes an antidote to accelerated aging. And the most beautiful part is that this kind of medicine costs nothing, and anyone with a caring heart can offer it. Once, while visiting a facility, I met Mr. Claudio, who every morning wrote little notes with blessings and positive words for his fellow residents. He'd slip them under doors, unsigned. When I asked why, he replied, "Because it doesn't matter who I am. What matters is I can still make someone happy." That simple gesture restored something sacred, a sense of belonging. Purpose in longevity is as vital as calcium for bones. It strengthens the spirit and sustains the body. And if you're reading this thinking it's too late, let me tell you with conviction, as long as there's a breath of life, there's something to be done. Fostering purpose is one of the most powerful ways to ensure well-being and healthy habits. Even a small project like cataloging old photos or teaching a grandchild to pray the rosary becomes a mission to the brain, and it responds with vigor. As we say in medicine, he who has a why finds a how. And the next point will show you that when the body stops, the soul is in danger too. We must care for the body as well, so now let's talk about physical inactivity. It's easy to see why many seniors become sedentary after moving into a nursing home. Everything seems arranged for convenience: ready meals, set schedules, overly comfortable chairs. But too much comfort comes at a high price. The human body, especially in later life, needs movement to stay vital. When a senior stops moving regularly, they begin to lose muscle mass, flexibility, and immunity. Unnoticed, what seemed like rest becomes a risk factor for infections, falls, and even respiratory illnesses. Mrs. Maria's story illustrates this perfectly. Before entering the nursing home, she walked to the bakery every day. It was a simple but essential ritual. Just 3 months of inactivity left her needing help to get to the bathroom. Her muscles weakened, her back began to ache, and her self-esteem plummeted. A routine exam revealed low vitamin D levels and premature bone thinning, something that could have been avoided with a 20-minute daily walk. The World Health Organization emphasizes regular physical activity reduces cardiovascular risk by up to 40% in older adults. You don't need to run marathons. Just keep moving with activities you enjoy. Simple morning stretches, household chores like sweeping, slowly climbing stairs, or tending a garden are excellent stimuli. The key is avoiding prolonged immobility. When the body sits too long, it begins to forget how to move, and the brain, in turn, reduces its plasticity. I've seen patients regain balance just from weekly ballroom dance classes and make new friends along the way. Whenever possible, I advise families to encourage these practices thoughtfully. It might be with favorite tunes from youth, group activities, or even playful time with grandchildren. What we cannot allow is excessive rest to become a prison. Longevity is built on movement, and movement in this case is the body's cry of freedom from a life that still wants to live. But what happens when the issue isn't movement, but dignity? We'll explore that next. Dignity is an invisible treasure, but its absence weighs like lead on an aging heart. In many nursing homes, elders are placed in shared rooms with rigid schedules and cold rules that completely ignore their personal preferences. It's in this environment that something sacred begins to dissolve, the feeling of being respected as an individual. When privacy is lost, even for a shower or a moment of silence, a subtle form of oppression sets in, and quietly, self-esteem begins to die, fueling a cycle of unhealthy aging. I saw this in Mrs. Alzira's eyes. At 78, she began sleeping facing the wall, even when sharing a room with kind people. It wasn't fear, it was shame. She told me, tears held back, "Doctor, I don't even have a corner to cry in." That moment stayed with me. Dignity is non-negotiable. It underpins well-being, even when health falters. And when dignity fades, an internal abandonment takes hold, and the will to live diminishes day by day. Studies confirm this phenomenon. According to the Journal of Aging and Health, loss of privacy and individuality in long-term care facilities is directly linked to increased depressive symptoms and weakened immune response. It's no coincidence. The body senses when the soul is ashamed. That's why I always recommend creating more flexible routines and personalized spaces whenever possible. A corner with photos, a curtain for bedside privacy, even the scent they used to wear. It all makes a difference. The truth is that an elder's resilience depends on how they're treated in the small details. When you respect their individuality, dignity becomes a vital force. And don't be mistaken, preserving privacy is also a way to prevent diseases, both physical and emotional. But there's an even subtler risk few mention. When a senior enters a nursing home temporarily and, for lack of support and confidence, never manages to leave, Sadly, that happens more often than you'd think. When an elder enters a nursing home just for a few days, few realize that this provisional period can turn into involuntary exile. What starts as rest or recovery stretches on indefinitely. And it's not out of malice, but due to a lack of emotional and familial structure. The senior gradually adapts to a passive routine, stops making decisions, and loses the habit of fighting for independence. The brain gets used to comfort, but the heart misses home. Health in later life must include the freedom to return. The problem is that, over time, many elders come to believe they no longer belong at home. Confidence erodes, family bonds weaken, and that once certain return fades from memory. I've seen cases where the elder himself would say, "I'm too much trouble at home." That phrase is a symptom of emotional abandonment. And worst of all, that feeling of uselessness is one of the most common risk factors for late-life depression. It's not the nursing home that makes you sick. It's the absence of real plans for you to leave when you wish. I always advise families to keep a plan B: regular visits, familiar objects in the room, fulfilled promises, and, whenever possible, temporary outings for family activities. This creates the perception that the elder isn't trapped but welcomed provisionally. The difference between being and staying changes the emotional impact completely. Full longevity depends in part on that sense of belonging and freedom. And even if a permanent return isn't possible, keeping the idea of going back alive sustains well-being. It's urgent to restore the elders' protagonism in their own story. It's not about romanticizing leaving the nursing home, but about ensuring they still have choices. The absence of a return plan can lead to silent surrender. And when the body gives in, the mind follows. That's why, as a physician, I state clearly, preserving even minimal autonomy is the most powerful remedy against abandonment. Because the greatest risk, many times, isn't staying in the nursing home. It's forgetting that the exit door still exists. And now tell me, did any of these truths strike a chord with you? Have you experienced or witnessed a situation similar to those we've discussed here? I invite you to share your story in the comments. It could light the way for many others going through the same phase. If this content helped you in any way, subscribe to the channel and hit the bell icon. That way, you'll receive new videos that can transform how you view aging, health in later life, and everything that truly matters in this stage of life. There's much more to come, information that can change destinies, protect families, and ensure more quality time. And I want you with me on this journey. Take care and see you soon.